Hi, I'm Dr. French, and I'm going to explain to you what a new patient visit would look like, especially in the time of COVID, where we're having to manage social distances and our safety protocols. So we'll come forward here. That's our sign. Welcome to the office. Now you'll see right here we have a floor button, and that is where you'll stand and wait to be invited in. The staff is over here, so we'll come and see that. This is the next holding point right here. And there's a receptionist who will be wearing a mask who's going to come have you do your hand sanitation. We do have COVID forms, but we'll also have those online and we can fill them out in advance. And those are your screening forms. We also take your temperature and make sure that you're not having a fever and any other symptoms. We then move to the waiting area, and you'll see that within the waiting area we have separated seating for 2 and a third seat over here. So we have a maximum of 3 seats at each given time. We don't have more than 3 people in the waiting room. So we move people right away from this point into a treatment room, which we'll see down the hall. Now, one thing that's very important that we've done in our office is these are closed-in rooms. So we have glassed-in operatories, and within the operatory, we have, just come and see here, HEPA filtration running, and those will clear the air within about 20 minutes to 90% clear. Then we also have UV light, which I'm going to demonstrate in the next room here. So that is UVC, and it's a specific wavelength that can kill viruses and bacteria in the air. We have those on safety switches, and you can see here, this is behind glass, so it doesn't transfer through, so you're safe. What that does, though, is that will kill everything in the air to 99% within about 4 minutes. As well, all of the surfaces within 8 feet that are in that light are just decontaminated within about 10 minutes. And we run each cycle after an aerosol procedure for 10 minutes. So the safety between the operatories is paramount, and we know that our patients don't want to be exposed to other aerosol risks from other patients. So that's what we're doing. Now in dentistry, we work in the field of aerosols. We're generating splash and spray, and we need to somehow protect ourselves to the highest level possible. So we would be using a face shield. We're going to be having some kind of hairnet or covering, and the face shield is going to go on as so. Now we're going to have a mask. There's different levels of masks. The requirement in Alberta is a level 3 mask, which looks like your typical dental mask. It's just a bit higher filtration. It does have some foam fitting that helps create a better seal, but even with this on, you can see there's going to be some space, and maybe not quite as high a level as what we used as our minimum standard in our office. Then we've chosen to go with the N95 or this KN95 version, and this would be our minimum treatment protocol, and it's what we were doing at the beginning of COVID. But you can see here already I'm fogging up inside this area, and if I'm doing a long treatment, sometimes I'm having visibility problems. So we've moved from this system, which is quite protective and adequate, to something that we felt was better. Here, this is called the Max Air Capper. And basically, there's a filtration system built into the helmet, and we have a full shield, plus within the shield is a neck cup. So this provides a full seal, but a respiratory protected environment for the worker, but also for patients. So I'm going to show you how this looks. We plug this in. We've got a little portable battery pack. Lights are green. That means we're good to go. You feel like you're going on a Mars mission here. So that is the capper. Now the beauty of this is we've got our seal here, and I have great visibility, and I have a fan running right now, so I don't fog up at all, and I can have great visibility. Plus I can communicate with you because you can see my face. So you're not just looking at the masked person. It makes it much nicer to communicate with patients. So if I'm meeting you for the first time, I'm not some masked avenger. I instead am just myself. And by the way, Each of our team members named our cap. I named mine Buzz Lightyear. We have Judy Jetson, Captain Marvel, and Rhea Skywalker. And we have one other one, which is our daughter is Ripley from the Alien. Thank you.